break, everyone. I think we'll start with our next speaker, who's Dr. Rob Billington. Rob is a member of class of 2003. He is presently faculty at the Academic Family Medicine Unit in Saskatoon since January of 2012. He's also the undergraduate program director for family medicine, U of S College of Medicine. He has degrees in biochemistry and pharmacy from the U of S. He practiced community pharmacy in Alberta and Saskatchewan for 8 years before returning to med school. Plus, he continued to work 3 to 7 days per week during his med school, his pharmacy. He is married with apparently 2 rotten kids and 2 very spoiled dogs. He says he has a very busy family life, lots of outdoor activities, and his wife also mentioned that his real age is 12 and he's stuck in the 70s. Rob's talk is Zooeyia in primary care, and I don't know what that is, so. Welcome.
Thanks very much. Thanks. Okay. Sure. So I hope everyone can hear me. I do apologize. I just showed up a while ago and sat at the back, and the screen does seem very far away. So if you can't see, please sit closer. On the other hand, this is going to be very casual, hopefully fun. It is, in my mind, real medicine, but it's not, you're not going to see a lot of graphs and a lot of charts. I hope you'll take something away that's informative. I will give a bit of what I think are the key points towards the end. And I'll keep you in suspense for a few slides as to what Zooeyia actually is. I've given you a hint there. That's my little daughter. I'd like to say it's on our ranch in Wyoming, but that's a rented horse in Cypress Hills. So, but okay, that's fine. So today, some of you have objectives if you had a package or electronic summary, but we're going to define what Zooeyia is and how it pertains to something called the One Health Initiative. We'll look at some of the evidence, but believe me, the evidence is overwhelming, and every time you look at one article, you'll end up with 10 more, and even though I've referenced, I think, up to 20 things at the end, there's tons of evidence. So I'm not going to go into each study, but I will put little tidbits of information when we're talking about the points in general. We're going to talk about the benefits of this concept. We're going to talk about the risks or the caveats to this concept. There's a clue there. It's the roles of animals in human life stages. And we'll look at a couple of cases, and I think hopefully lots of you have some experience with this as well. The last objective I have is I'm going to poke a little bit of fun at my friend and colleague Jason Hossain, who volunteered me for this about a month ago, as he has volunteered me for a few other things this year, and as typical, he's not here, so we can have a few laughs, hopefully at his expense. So I don't really have any commercial or financial associations that would affect this. I am completely biased in my support of this concept, so I will admit, and you'll see that quite clearly. So definition of Zooeyia. Well, it's not really anything to do with the actress Zooey Deschanel, and that's much to Jason's chagrin, because he is completely in love with her, and so it begins. Okay. So Zooeyia is really looking at the positive impact of animals on human health. I have some longer talks that I've given up to 9 years ago that talk about everything from formal animal-assisted therapies and autism and so many things. Zooeyia that we're talking about is the companion animal. A little bit more commonplace, a lot less broad topic, if you want to say it that way. But this is a made-up word by some of the people involved, and it's using the Greek word for animal mixing with the word for health. And Zooeyia is kind of the opposite of zoonosis. So zoonoses are diseases that affect humans and animals in a negative way. They can be spread in either direction. And 61% of human infections are zoonotic in origin. And about 70% of the emerging diseases, whether it be bird flu or some of the other parasites that are emerging in the world, are zoonoses. It maybe has something to do with climate change, increased travel, increased urbanization, encroachment on animal habitats. But zoonoses are a huge part of human health, and that's really what a lot of the One Health initiative was about, and I'll explain that a bit. So these things come out of or are being promoted more because of the One Health International Initiative, which is an international project. I think the last conference was in South Korea, but it's looking at the health of humans, animals, and the environment. So on large scales, it's done in environmental settings at government levels, whether they be international, continental, federal, provincial. And the primary people involved are veterinarians and primary providers for human health at our community level. So at the level that we're going to see it, it should be us. It should be people like us. These people are also involved in the high levels with the federal government and things like that. But up till now, though, the One Health initiative, as far as animals and human health, was looking at the negative aspects. So most of the studies were done in terms of zoonotic infections, zoonotic injury like trauma, dog bites, cat bites, whether they're infected or not. So wouldn't it be nice if there was an effective therapy for chronic diseases, maybe around $100 a month with minimal side effects, but proven to help with things like mood, social functioning, chronic pain, memory. Well, today is the day, so, okay. So the chronic diseases in Canada that have the highest cost to our health system financially, administratively, and to the patients and families, in no particular order are those ones there. So cancers, cardiovascular disease you heard about recently, diabetes, certainly obesity, psychiatric illness. I estimate that at least half of my practice is having psychiatric illness as a huge part of their health, whether that be the presenting illness or not. And again, in this case, we're talking about companion animals. If anybody wants the larger talk sent to them on PDF, you can let me know, but we're not talking about some of the formal programs called animal-assisted therapies or animal-assisted activities. But companion animals can positively affect some of the controllable factors. And I say that because we know that many diseases don't have controllable factors. You're going to have it or you're not going to have it. But other factors that we can control, companion animals have been proven beyond a shadow of a doubt, except for Australia, which I may mention later, to have positive benefits in these areas. So this year I've used animals in the family to help 2 people quit smoking. It was a huge incentive for them. Certainly for social isolation, certainly for social lubricant, where you use the dog as a go-between to meet new contacts and to get outside. And even companion animals have been shown to improve functioning with activities of daily living, especially for seniors. I was going to do a Mythbusters on this, but then I looked at a picture of our puppy who was black when I got her, and now a year later she looks a lot like me, so that Mythbuster is not going to be busted. So it is apparently true. So a little bit of history as far as using animals in human health. The ancient Greeks used animals not only for war and hunting and security. They did use dogs specifically in human health as far as companion, rehabilitation from injury. The first sort of modern era use of animals in human health was at the psychiatric asylum in York, England, where William Tuke used a lot of domestic animals, including farm animals, on the grounds of the retreat or the institution, and got the psychiatric patients involved with looking after them, using them for social lubricant, opening up a go-between. And that's actually quite some time ago. Florence Nightingale, legend has it, she actually became a nurse, and her first patient was an old sheepdog named Cap. But she used animals in pet therapy in the Crimean War with the wounded soldiers. Even in 1867, they were looking at not only dogs sensing epilepsy, which they do today. I have a friend who has an epileptic sensing, or a seizure sensing dog. But they actually used animals like horses and dogs to treat epilepsy in Germany to see if there was a calming effect so that the seizure threshold wasn't lowered and cut down on seizure. And actually, it says 1944 there, but in 1919, formal projects were started by the U.S. government, the U.S. Army. 1942 and 1944 in the U.S. with the airmen, wounded veterans, animals were used in their rehabilitation as companion animals, not seeing eye dogs, things like that. For the general community, the Green Chimneys project was started in New York State quite some time ago, and it involved essentially farm animals with children at troubled youth camps and giving them activities, not just a sense of responsibility and doing chores, but using the animals as therapy. And that project is still ongoing, and it's everywhere now. The modern day, and I put pioneers because you saw that I mentioned ancient Greeks, even Egyptians used animals in health, but Dr. Levinson is somebody who had his own dog at the office and had a particularly troubled, essentially catatonic teenager. And when Dr. Levinson went to get a cigarette or a coffee and came back, the child was speaking to the dog, speaking to him for the first time ever. So he began to incorporate this and began to look at that. Similar stories with Dr. Corson. They lived near an animal rescue shelter, found that the kids would open up, kids would come back more often. They involved the dogs formally and took it from there and have been doing that work forever. There was a sort of a symposium on this at the University of Pennsylvania in 1981 that said, you know, there might be something to this. There's National Institute of Health workshops that have been done on this that says we should really keep going forward with this. The Delta Society is a society that was formed many years ago, but it's actually more involved in the animal-assisted therapies I talked about, animal-assisted activities. This is a more formal, structured training process for animals. They have to go through certain qualifications, and a lot of them are done through the American Kennel Club or Canadian Kennel Club, just like they would be for obedience or agility. But these things are out there, and I'm sure lots of you know of animals in health practices. I know of one of the internal medicine specialists who uses a therapy animal in her practice. Again, recent is quotation because it's not that recent, but since I gave the first presentation on the general concepts 9 or 10 years ago, this has become somewhat fashionable. So you'll see on lots of the cable channels shows like Dogs with Jobs, I Was Saved by an Animal, Pit Bulls and Parolees, the Pet Hero Stories, Women Behind Bars. And Jason said he couldn't wait to watch Women Behind Bars, but it was one of the major TV disappointments of his life. It wasn't what he was hoping it would be. But even in Ontario, the women prisoners have trained therapy dogs for people and not just use them for companions for themselves. But a lot of the stuff is out there, so even if you had no interest in this, you're going to see on Pet Planet or Discovery shows about animals and human health from a lay perspective all the time. 50 to 61% of North American homes have one or more pets. And most households with children have a pet of some sort. People consider them a member of the family. They consider them a person. This is not an insignificant relationship. In lay terms, there's some benefits of pet ownership. I think most of us would say, well, I hope you get love and affection out of it. But we'll talk about some of these later. But reality orientation is very useful for people with mental illness and seniors with dementia. It can be a common ground for people, but I think of that as a common ground for us. And certainly I use it in my practice. I know other doctors do as well. I see a lot of my patients at the off-leash park. This is not a benefit of having a pet. The labs cannot hold their liquor. So if you're looking for a drinking buddy, look somewhere else. So we're going to talk a little bit more about the benefits. But it's true that blood pressure drops when you're physically interacting with animals. So when people are petting dogs, their systolic can drop 10 to 15 points. You could actually have a drop in your blood pressure when your dog looks at you and you look at your dog. Now, obviously, you can't do that all day long. But, and if you think about it, even without knowing the information, obviously, if a dog's getting you more active, if a dog is helping with stress, you would expect your blood pressure to be lower. But interestingly, cats have been proven to decrease cardiovascular disease, including stroke. And it's actually not an insignificant number. The Lisinopril study that was done in that first point there was people that were diagnosed with hypertension. None of them had animals. They gave one group animals plus lisinopril. They gave the control group lisinopril alone. And 6 months later, they evaluated their blood pressure effects under stress. And what they used for stress were standardized tests they do in cardiology studies that were math and language skill examinations. And the people who had pets did not have the rise in blood pressure during the stressful. And as you might expect, all other variables were accounted for. Certainly the social lubricant one I'm going to talk about a little bit, but it certainly makes sense. And in our neighborhood, we have an informal dad's club that at 11 o'clock at night, there seem to be about 6 of us out there once the kids are in bed and things are winding down, that the dad's out walking the dog. It doesn't matter what stage of your life, but we'll talk about this a bit, but it gives a sense of protection, responsibility, whether it's a child learning to care for something, whether it's somebody who has not had a good history of being responsible. Certainly they've been proven to increase people's self-esteem and sense of worth. And from chronic pain, I put this can be a distractor, but really it can be a distractor from any chronic illness. And people who have animals have been proven to have decreased recovery times from injury or illness. And I also put incarceration on there. It's often a motivation for people to rehab themselves in that way as well. For children, dogs and cats, the companion animals, and again, could be turtles, hamsters, things like that. One of the things that is most significant in the studies is that it's really a confidant for the child, especially if a child is having problems, someone for them to talk to, someone that supports them no matter what. When children have a fatal or chronic disease, the animals don't see that disease. They still see the child as a person. And we'll talk a little bit about that as well, but increased communication is essentially what I mentioned with some of those physicians who worked on this, is that it was a bridge. So it was something to do. I come to see the dog, I talk about the dog, I talk to you. Now, next thing you know, I'm talking to you. I'm talking to the therapist, the psychiatrist, or the doctor. There are senior adoption programs out there, and one of the advantages of senior adoption programs is that people adopt the senior animals knowing that they're only going to live for a few years, but they will often pick them at a certain time in their child's development to teach them about life and death before they're having to deal with a lot of life and death with human relatives and friends. It's certainly been shown to be very useful in post-traumatic stress disorders. There are some incredible programs in the US that match the service dogs who are retired or discharged from the Army or Navy with wounded veterans. I met Nero, the hero, down in Sturgis, South Dakota a couple of years ago. This German Shepherd had been accounted for saving 3,400 lives as a bomb detector and security dog. He'd been blown up twice, had his back shattered, had been repaired, and because it's kind of difficult logistically to discharge a dog from Afghanistan and send them home, they usually just give them a lead injection and that's it. And that seems like kind of a crime. So if one of us had saved 3,400 people, been blown up twice, we would probably receive accolades, not a bullet. And so this program actually brings those dogs home and matches them to wounded veterans. They provide all the food, the extra vet fees and things like that, and they only give them to wounded veterans with the idea that they have something in common. For seniors, the comment there about gray matter, they actually took adult patients, older adult patients, those that had animals, and used them to be outside, specifically walking 72 blocks a week or more. So you could say that's not having anything to do with the animal. If you walked 72 blocks a week or more, it shouldn't matter. But 9 years later, they checked them, and they actually had more gray matter in the areas of hippocampus and things like that. And this is felt to be significant in terms of cognitive skills or maintaining cognition. They also had increased walking endurance, regardless of any other variable, any other comorbidity, any other test for executive functioning that they did. And for mental illness in general, whether it be inpatient setting or outpatient setting, patients had decreased hostility, more self-esteem. They actually showed up at their sessions more often. And we see a lot of patients with anxiety disorders, and sometimes the best treatment for them is a therapy, but how many of them show up at their therapy? They're anxious, they don't want to go to therapy, and it's very frustrating because you've done all these things for them, but they don't go. And they actually have increased attendance if you use the animals. The other program for the military that's footnoted at the bottom is the Nobody Left Behind, and there is another charity that takes the pets that were adopted overseas, like in Iraq and Afghanistan, by the soldiers who are there and brings them home to be with them when they're here. And actually, there is a story about one on television from Regina, but this is a formal program out of the U.S. So they're talking about senior activity. If you live long enough, you will place first. So when your pacemaker is sticking out on one side, I suspect the judges detract some points for symmetry in bodybuilding, but I'm not really sure. So that's your goal. You don't have to be in particularly great shape, just outlive everybody else in your age class. So again, don't spend a lot of time trying to memorize anything. These are just some flashcards, just some quick snappers. But when you're looking at families with pets, I mentioned about 80% of families with children have pets. But when we looked at abusive parents, only 3.7% of them had a pet as a child. Now, that's not unclear what the connection is. It could be that the child was malicious towards the animal, and that's why they got rid of an animal or couldn't have an animal. But when you're not having an animal in the house and you've got that kind of a number, you have to wonder what the association is. I remember I mentioned this second point to Dr. McKee one time, and she was concerned then because her cat slept in a different level of the house. But if you've got a pet in a family and there's abuse in the family, that animal is more likely to sleep in a different level of the house than the family, or outside or in the basement. People in abusive families don't typically have pet birds. I don't know what the connection is there either. And the pet is often used, just like some bullies will use a favorite toy, as the object of threats and violence. Depression, I think, would be relatively intuitive that animals should be helpful with that, but when older adults that were chronically ill, so not terminal necessarily, but had depression, met the criteria for depression with chronic illness, had animals visit them on a regular basis, they were significantly scoring better by self-scoring on depression scores than those who only saw the human counselors. And we have measured some neurotransmitter changes, dopamine being one of them when animals are present, oxytocin, which is kind of the nurturing hormone. Again, the significance, I'm not sure, but there are physical changes. It's not just kind of touchy-feely, I think I like dogs and cats. There is something that goes on. We talked about kids a little bit, but more kids stuff. Kids with chronic illness do tend to cope better with animals. They have less support. A UK study recently suggested it showed significant results that 9 to 10-year-old children with animals were significantly more active and healthier than kids without. And you might think that sounds intuitive as well, but surprisingly, a lot of the data out there does not show a difference. And I mentioned Australia earlier. In Australia, the people that didn't have pets seem to have better cardiac makeup, or better cardiac health, I should say. People with pets reported more stress and more depression. I'd like to turn that around and say that maybe they had the animal to help with their stress and their depression. But strangely enough, some of the numbers from Australia debunk a lot of the other strong studies. The animal can be a transition object. So if we're going to move from here to Calgary, well, that animal stays pretty constant. It can be a transition object from moving from stage to stage, whether it be from school to school, whether it be from moving from childhood to early adulthood. We mentioned the responsibility training before. And kids who have learning disabilities seem to do better when an animal is part of their therapy informally or as a companion animal. And you may have seen some of the stories on TV about autism in dogs. There's one about autism in pot-bellied pigs. There are autism and horse programs in Saskatchewan. Looking at long-term care and dementia, and many of you probably know that your local nursing homes, and some of them here, have animals in the home. And I used to use my dog when I worked in Alberta, Regina. We do feel, and I don't think it's a big surprise, that lack of companionship and isolation are a huge contributor to health in the elderly. And it's not nice to say, but when you're losing your friends and your spouse and people around you to death and illness, it's hard. And not just at home, but a companion dog on the Alzheimer's unit, they reported fewer agitation episodes, fewer aggressive behaviors, less shouting out, less confused wandering in the daytime versus those who didn't have the animal present. The Alzheimer's patients who live in the community tend to have less anxiety and less verbal aggression. And it seems to help with reality orientation, because whether it's good or bad for some of us, dogs especially like routine. They can tell time. And they are there every day, constant every day, same time, same routine every day. So it's good for reality orientation. People, in some studies, live longer if they have an animal with terminal illness, accounting for all other variables. Whether that's going to remain or continue to be proven is unsure. Pet owners seem to progress through the stages of dying a little bit better in terms of making preparations for their animal when they pass away. The PAUSE program was begun during the middle of the AIDS epidemic, and its patients are wonderful support. And it was a program out of San Francisco that provided vet fees, dog sitting, food, finances, so that AIDS patients could keep their pets as long as possible. Since that program was begun, over 30 different agencies include things like that. They expanded it not so long ago for seniors' long-term care programs as well. And we'll see how the results show. Here are the risks or the caveats, and some of them are quite obvious, and you may have some more that you've thought of. Allergies, well, I'm not going to make somebody have an animal if their eyes swell up and they can't breathe. Some people physically cannot care for an animal. They don't have anyone who can help them care for an animal. Mentally, they shouldn't care for an animal. If they try to put batteries in their toy poodle, that's maybe not the best thing for them. So, financially, it's a burden, of course. Some people aren't allowed to have an animal. It might be the best thing for them, but they shouldn't have an animal where they live, or their routine doesn't allow for one. In cases like that, I sometimes have people volunteer at the different pet agencies, and they used to be able to go over to the pet stores and volunteer as well. I put dying arrangements, so living arrangements and dying arrangements. Animals die, people die. It's a fact of life. There's nothing sadder than seeing a dog at the SPCA, 8 or 10 years old, whose owner died, and now they're surrendered. Reptiles seem to carry a lot of infections that aren't so good for immunocompromised patients, and specifically things like salmonella. So if you've got somebody on a heavy-duty immunosuppression, having a turtle, a snake, a lizard isn't a good pet for them. You have to consider danger to others. No matter how good a dog is, it's felt that dogs do not recognize children until they walk and talk. And up to that point, they're seen as prey. And so we've all heard sad stories about them attacking a newborn, and they just don't identify them as humans. Toddlers, my daughter, when she was 1 and walking, learned very quickly that when the doorbell rang, you jumped on the ground and you covered your head because the dog's going to run to the door. Right or wrong, that's what happened. Elderly, if you bump grandma down and break her hip, that's not so helpful. If somebody's disabled and you've got a rambunctious animal or a vicious cat, that's not helpful. And unfortunately, compared to humans, pets don't live so long. The animals do get sick. It's accepted and fashionable to take your animal to the vet now, whereas years ago, people would never do that. And it can be quite financially expensive as well as emotionally draining. And we talked before, of course, that if you've got a pet that outlives you, you do want to make sure that you arrange for them, because people get quite upset thinking that something will happen to their animal when they go. Oh, if you like taking pictures of your family on vacation and things, unfortunately, you're going to get a lot of animals in the picture accidentally, so they will photobomb you. I laugh. I've seen everything from Rolling Stone to Time Life to Chatelaine with the back end of a dog walking through the picture. I don't know what it is. So I don't know if these people knew the dog was there, but their nice little engagement pictures essentially needs to be photoshopped. So also, one of the caveats you should know about, you cannot take a dainty little cat person like Jason Hossain, add a dog in, and he has one, that's Oliver, and turn them into a dog person. It just, no. So don't say, you know what, Mrs. So-and-so, I know you've got a cat, but I think an Irish Wolfhound would be better. No, you can't make them change, so don't do that. This is just a quick snapshot. Kate Hodgson is a vet, as is Marcia Darling down in Ontario, that do a lot of work with this. They've devised these stages of life. We all have terms for our stages of life. We've learned different terms. This is how they look at it. The first stage is independent adult, where you're actually leaving the home. You're starting to take on adult responsibilities with a job, your own place. In that time, well, you might see a pet being there for companionship or security. A single woman has a pet that barks when someone rings the doorbell. That's security. And interestingly, it doesn't matter how big the dog is. The people that are break and enter people, cat burglars, say it's the sound of the dog. So they can have a little dog, and that gives them security. The marital dyad, the dyad is 2, so that's before you have children. Starting to strengthen the bonds in your relationship, gives you a little bit of practice. I think all couples should have to have a mammal before they are allowed to have children, but that's just my thought. The young child families, when your first child is born, then you've got infant at first with lots more attention to the infant. Pretty soon they become toddlers. Your lifestyle changes, your activities you do changes, the role of the animal may change. As a school age, you start to have more responsibilities, different events you're going to, soccer, lots of activities. The child's going to run into a lot more peer pressures and pressures in general, so the dog becomes very useful for them as a confidant and a playmate. As we're getting ready to have our children move on, as people in the family are getting older, the dog can be a very good stress reliever for studying for exams. It can be somebody that's always there for you, the constant support. Dogs don't care who you are, what kind of person you are. If you're their person, you're going to be loved. The empty nesters will sometimes get new animals at that point, but if they have an animal, that dog might fill the void from their child leaving. There are concerns about, child care from the grandchildren and the child coming over. And then in the elderly, we've talked about that, many benefits. So just quickly here, this is a typical case that you might think of. Oh, sorry. Okay, I'll just do this one here. But so Mr. and Mrs. T, they are nice dual income, no kids. They had her father live with them for years and years. He was chronically ill. They didn't feel they should ever have an animal because he had so many comorbidities and was allergic. But they have a nice house with a fenced-in yard. When the father-in-law passed away, and yes, this husband and wife together were 800 pounds. I was after them for years to think about an animal, and it changed their lives. They got a nice little Shih Tzu cross. Oops, sorry. There we go. Got a nice little Shih Tzu cross, got them out, got them walking, got them doing activities with other pet owners like camping. A year later, they got a second dog. The dogs are on their Christmas cards. They have more social contacts rather than just people at work. They are happier. He's lost 100 and some pounds. It's an obvious case, and you don't have to go into hard science for this. I mean, this may not work for everybody, but there are lots of cases, and I'm not going to belabor that. So, can they get along? Yeah, it seems like cats and dogs can get along if the dog is the one that does the getting along here. So, my brother's cats will keep my dogs anywhere they want to keep them because my dogs are too polite to go do anything about it. But so the key points: there are benefits, but there's also risk to Zooeyia, so don't consider it lightly. Benefits are well documented. You're going to see a lot more information in the next few years. But at least when you're talking to your patients, consider, is there an animal in the story? Is there an animal in the story? Where do they fit in that patient's life? What is their role, and what can we do with that animal? And if you yourself are a pet owner, which many doctors are, I'd like to see that study actually, how many doctors are, consider using it as common ground with your patients. It is such an easy icebreaker. And there are tons of references there. If anybody wants a copy, I will send it to the alumni people. I tried not to speak too quickly, but I just barely finished. Any questions? Are you ready for sleep? Oh, go ahead. Yeah, hi. Yeah, good for you. I'm glad to hear that, and more people are saying that. And interestingly, yeah, in the studies for children and pets, the pets do not increase the likelihood of atopic airway, atopic skin disease. It's really the parental history that's the key. So if a parent has asthma, atopy, and a pet's in the family, those children are more likely to be asthmatic. Right. There actually are studies that were done prenatally as well with that, as well as infancy, and that shows that exactly. So, and I'm also the last person to say get rid of that animal. So, yeah, cats are more allergenic than dogs, but still, there's a lot of health benefits to them. So, okay.
Is there one more question?
Oh, go ahead, Heather.
I had a patient ask me recently if I would give her a certificate to use her dog as a working companion. And I said I could, but does anybody know, like if you're a business owner and they won't exclude service animals, like is there a
Yeah.
certificate somewhere that you download or?
Well, I don't know if this was recently, but 2 nights ago on the Regina News, they showcased some businesses that allow employees to take their animals to work for decreased stress, increased productivity. It'd be different if it was a formal program the dog was involved in, so you really can't say, yeah, that dog could be a therapy animal for disabled children. That dog would have to go through the Delta Society guidelines for that. But you're talking about just taking the animal to work with them?
Well, my patient isn't working, she's retired,
Oh.
but she's very shy, very anxious, doesn't like to leave home. And she would like to be able to take her dog to a restaurant or to
Oh.
get groceries or whatever.
Well, apparently she moves to the UK, you can do that, so you can take your dogs in the pubs and things like that. But no, I'd be very leery of doing that because, who's going to be liable if that dog snaps at a kid who gets in its face, and that'd be you probably, so, or could be you. So I'd be very leery about that. I'd have to say no. They can use the dog, but I don't think in that way, yeah. Oh, sorry, real quick. I'm sorry, what was the question?
What diseases can dogs get that put the human residents on the host?
A lot of the same coronaviruses, arboviruses, things like that we get, they can have. They can get, whether it settles in the gut for diarrhea or vomiting. Some of the skin conditions they can have, certainly we know about the dermatophyte infections and things like that. There are tons and tons of them. I didn't want to get into some of the parasites because there's so many of them and there's so many different thoughts about that, about deworming and things like that. But they can go back and forth from children to animals. But 61% of human infections are zoonotic or animal, passing back and forth. A lot.